Examine the lower airway of the horse and summarize the findings. So examination of the thorax, inspection, observation, palpation, auscultation, percussion. Ancillary diagnostic methods are endoscopy, radiology, ultrasound, CT scan, and tracheal or bronchial lavage. So inspection or observation. Observe the breathing patterns from both sides and check the contribution of the rib cage and the abdomen towards ventilation. Check the animal's head position if it's extended to promote air intake, and look for nasal flaring. The normal respiratory rate should be between 10 and 18 breaths per minute. Check the rhythm and the depth. So for auscultation, check at least one inspiration and expiration at each spot, and examine both sides. Start cranially behind the scapula and move 2 intercostal spaces caudally, and start dorsally and then move ventrally. The normal lung sounds, you should have bronchial sounds in the large airways and vesicular sounds in the periphery. And change in sounds could be pneumothorax, it's quieter than normal sounds. Or increased intensity sounds, increased rate is due to tachypnea. Increased inspiration sounds is extrathoracic, and this is the large airway obstruction. And increased expiratory sounds could be a partial collapse of the interthoracic airways. So the abnormal sounds. So if it's discontinuous, these are the crackling sounds. So an obstructive airway disease, it can be caused by inflammation that it obstructs the airways, or continuous, these are wheezes. So it constricts the airways, and it can be caused by secretions in the narrow airway lumen. So for percussion, this is to isolate the regions where the air is lost. So the equipment use a plexometer, and the features are the intensity, sharp, should be strong, sharp, and low, resonant, and short sound. The normal lung borders are the deltoid tuberosus at the 7th, at the shoulder it's the 10th interstitial space, and the sciatica is 14th intercostal space, and the tuber is the 16th intercostal space. For decreased resonance, it's the accumulation of fluid or hemorrhage within the lung, a large mass or a tumor or an abscess. And decreased hemorrhage after trauma could be hemothorax or a diaphragm hernia. And increased resonances could be pneumothorax or emphysema. And for an endoscopy, so this is inspect the trachea and the mainstream bronchi, and biopsies can be taken with an endoscope. For radiology, this is inspection of the lungs and the components, and you take a radiograph during inspiration, and the placement of the cassettes are dorsocaudal, ventrocaudal, dorsocranial and ventrocranial, and positioning is on the right and the left side. And for ultrasound, it's the pleural effusion, the diaphragmatic herniation, and the atelectasis.